public health officials and maritime authorities are currently on high alert, following reports that hantavirus, a group of viruses typically carried by rodents, may be expanding its geographical footprint through international shipping corridors. The headline framing this development suggests a significant shift in the global distribution of the pathogen, particularly as European ports begin preparing for what is described as a worst-case scenario. To understand the gravity of these preparations, it is essential to establish what hantavirus is and why its presence in major transit hubs represents a complex challenge for infectious disease surveillance. Hantaviruses are a family of viruses spread mainly by rodents. Each hantavirus strain is usually linked to a specific rodent host species. The virus is shed in the urine, feces, and saliva of these animals, and is most commonly transmitted to humans when they breathe in air contaminated with the virus, a process known as aerosolization. This often occurs when dried rodent excreta are disturbed during cleaning or industrial activities. While hantavirus is not a new discovery, its movement across oceans, presumably via stowaway rodent populations in cargo containers or bulk carriers, raises the stakes for international trade and biosecurity. In Europe, the primary concern has historically been strains that cause hemorrhagic fever with Raynaud's syndrome, or HFRS. These strains, such as the Pumala or Dobrava-Belgrade viruses, vary in severity but can lead to acute kidney failure and systemic hemorrhaging. However, the mention of the virus crossing the ocean suggests the potential introduction of New World hantaviruses, such as the Sin Nombre virus or Andes virus, which are prevalent in the Americas. These strains are associated with Hantavirus Pulmonary Syndrome, a much more lethal respiratory condition with mortality rates that can exceed 35 to 40%. The framing of this current situation emphasizes a transition from localized rural outbreaks to a systemic logistical threat centered on high-traffic maritime infrastructure. Viewers should care because the stability of global supply chains relies on the health and safety of port workers and the integrity of the environments through which goods pass. If a viral reservoir becomes established in an urbanized port setting, the difficulty of eradication increases exponentially. This report examines the technical and logistical preparations currently underway as officials attempt to reconcile the needs of global commerce with the necessity of preventing a zoonotic spillover event that could have far-reaching implications for public health and the economy. As European port authorities and health agencies coordinate their response, the focus has shifted toward the specific mechanisms of surveillance and the role of diagnostic laboratories. In the core of this development are the logistics of international shipping, which provide an ideal, albeit unintended, conduit for rodent migration. Modern shipping containers are designed to be weathertight, but they are not always rodent-proof, especially when stored in inland depots prior to being loaded onto vessels. Once a container is sealed, any rodents trapped inside have access to whatever organic material might be present, allowing them to survive long transoceanic voyages. Upon arrival at major European hubs like Rotterdam, Antwerp, or Hamburg, the discharge of these containers presents a primary point of risk. Health agencies are now looking at intensified screening protocols that go beyond standard agricultural inspections. This involves the use of environmental DNA testing and specialized rodent trapping programs around docking berths to identify if non-native species are carrying exotic viral loads. Laboratories tasked with this work are utilizing reverse transcription polymerase chain reaction, or RT-PCR, to detect viral RNA in environmental samples and animal tissues. This molecular approach allows for the rapid identification of specific hantavirus strains, which is critical for determining whether a localized find represents a known endemic strain or a newly introduced foreign pathogen. Beyond the labs, the worst-case scenario mentioned by officials involves the potential for the virus to enter the local synanthropic rodent population, meaning those rodents that live in close proximity to humans. If a foreign hantavirus strain were to jump from a shipborne rat to a local mouse population, the virus could become a permanent fixture in the urban landscape. This would move the threat from a manageable logistical issue to a chronic public health concern. There is also the matter of verified data versus speculative fear, while the headline indicates a global threat. Official statements from organisations like the European Centre for Disease Prevention and Control typically emphasise that while the risk of individual cases is real, the likelihood of a massive, sustained human-to-human outbreak remains low for most hantavirus strains. The exception, which keeps experts cautious, is the Andes virus found in South America, which has shown a limited capacity for person-to-person transmission in specific clusters. Therefore, the core of the current institutional response is a combination of rigorous environmental sampling, the hardening of port infrastructure against rodent entry, and the close monitoring of hospital admissions for any clusters of unexplained respiratory or renal distress among port employees and transport workers. Prevention and public guidance remain the most effective tools in managing the risk of hantavirus as it moves through international channels. For those working in logistics, maritime trade, or even residents living near major transport hubs, the primary defence is the elimination of rodent habitats and the strict adherence to safety protocols when dealing with potential contamination. Public health guidance emphasises that areas with signs of rodent activity should never be swept or vacuumed, as these actions kick up the very dust that carries the virus into the lungs. Instead, officials recommend the use of disinfectants, typically a mixture of bleach and water, to saturate any droppings or nesting materials before they are carefully removed with gloves. In an industrial or port setting, this means enhancing the use of personal protective equipment, or PPE, including N95 or higher-rated respirators for workers handling cargo from high-risk regions. Despite these clear preventive steps, there are honest limits to our current knowledge that complicate the long-term outlook. One major uncertainty is the impact of changing climate patterns on rodent population cycles, mast years, where an abundance of food leads to a population explosion, can significantly increase the viral load in the environment. Additionally, because the incubation period for hantavirus can range from several days to several weeks, identifying the exact point of exposure in a globalized workforce is notoriously difficult. This creates a lag time between the introduction of a virus and its detection by health authorities. Furthermore, there is currently no widely available vaccine for hantavirus in Europe or the United States, unlike in some parts of Asia where vaccines for specific strains have been utilized. Treatment remains largely supportive, focusing on oxygen therapy and, in severe cases, extracorporeal membrane oxygenation or dialysis. As surveillance continues, the calm consensus among experts is one of guarded, active monitoring rather than panic. The goal is to create a biosecurity shield at the ports that can catch these threats before they move inland. This requires transparency between shipping companies and health regulators, ensuring that any sightings of rodent infestations on vessels are reported immediately without fear of excessive financial penalty. For now, the global public health community remains focused on data collection and the reinforcement of basic sanitation and exclusion tactics. By treating the port as a front line of biological defence, authorities hope to mitigate the worst-case scenarios and ensure that the movement of goods does not become a movement of disease. For more updates on global health reporting and emerging viral threats, consider subscribing to this channel. The core of the current public health development centres on the intersection of international logistics and zoonotic surveillance. When official reports indicate that hantavirus is crossing the ocean, the primary mechanism identified by epidemiological experts is the movement of rodent reservoirs within the global shipping network. Modern maritime trade involves the transit of millions of 20-foot equivalent units, or TEUs, which provide countless microenvironments where rodents can survive long-haul voyages. Port authorities in Europe are now focusing their efforts on the potential for stowaway rodents to introduce non-endemic viral strains into local ecosystems. The worst-case scenario cited by officials involves a process known as viral spillover, where an exotic hantavirus strain, perhaps one associated with the highly lethal Hantavirus Pulmonary Syndrome found in the Americas, is transmitted from a ship-borne rodent to the local, synanthropic rodent populations that live in and around European port cities. If such a transition occurs, the virus could become established in a new geographical niche, making eradication nearly impossible and creating a permanent public health risk for the surrounding urban populations. To prevent this, major hubs like Rotterdam and Antwerp utilize integrated pest management strategies which combine physical barriers, habitat modification, and biological monitoring to maintain a sterile zone between the docks and the inland infrastructure. In the clinical and laboratory sectors, the response is increasingly focused on the speed and accuracy of diagnostic differentiation. Because hantavirus symptoms, such as fever, muscle aches, and fatigue, often mimic the early stages of influenza or other common respiratory illnesses, the role of specialized reference laboratories is critical. When a suspected case is identified in a port worker or a traveller from a high-risk region, clinicians prioritize a detailed travel and occupational history. The testing protocol typically involves enzyme-linked immunosorbent assays, or ELISA, to detect specific antibodies, and reverse transcription polymerase chain reaction, known as RT-PCR, to identify viral RNA in the blood. In Europe, labs must distinguish between Old World strains, such as the Pumala and Dobrova viruses, which primarily cause hemorrhagic fever with renal syndrome, and New World strains that might be introduced via transoceanic trade. This distinction is not merely academic, it dictates the level of supportive care required, as Hantavirus Pulmonary Syndrome can lead to rapid respiratory failure and requires immediate access to intensive care units and, in some cases, extracorporeal membrane oxygenation. The Global Threat designation serves as a trigger for these facilities to increase their testing capacity and to refine their sequencing pipelines to ensure that any mutation or novel strain introduction is detected in real time. From a regulatory and trade perspective, the movement of this pathogen places a heavy burden on the international health regulations framework managed by the World Health Organization. Under these rules, ships are required to maintain a valid ship sanitation control certificate, which serves as evidence that the vessel is free from vectors like rodents and insects. However, the sheer volume of global trade means that inspections are often conducted on a sample basis rather than a universal one. European port officials are now considering stricter enforcement of these certificates and more frequent deratting procedures for vessels arriving from regions with known hantavirus outbreaks. There is a delicate balance to be struck between maintaining the flow of essential goods and ensuring biosecurity. If a vessel is found to have a significant rodent infestation coupled with a suspected viral case, the resulting quarantine and decontamination protocols can lead to millions of dollars in losses and significant delays in the supply chain. Agencies are also looking at the health of the maritime workforce. Port employees are often the first to come into contact with potentially contaminated cargo containers. Educational programs are being distributed to emphasize the importance of identifying rodent sign, such as droppings or gnaw marks, and reporting them immediately to health safety officers before any cleaning or unloading begins. Finally, it is essential to contrast the verified epidemiological data with the more sensational claims of a looming global catastrophe. While the headline framing suggests an imminent disaster, public health agencies emphasize that hantaviruses are not typically characterized by efficient human-to-human transmission. Unlike respiratory viruses like influenza or coronaviruses, hantavirus remains primarily a zoonotic threat, meaning the risk is concentrated in specific environments where humans and infected rodents overlap. The global threat in this context refers to the geographical expansion of the virus's range rather than its potential to cause a person-to-person pandemic. Health officials clarify that as long as the transmission cycle remains tied to rodent-human interaction, the threat can be managed through environmental controls and professional hygiene standards. The uncertainty remains centered on the adaptive potential of these viruses and whether a strain could emerge with enhanced stability in aerosol form or, in rare cases, limited person-to-person capability as seen with the Andes virus in South America. For now, the verified development is a systemic tightening of the biological shield around Europe's ports, as authorities work to ensure that the vital arteries of global trade do not become unintended pathways for viral migration. Addressing the escalating concerns surrounding hantavirus requires a shift from reactive measures to proactive prevention and sustained public health surveillance. The most critical practical takeaway for both industrial workers and the general public involves the management of rodent-prone environments. Because hantaviruses are primarily transmitted through the inhalation of aerosolized particles from rodent excreta, the method of cleaning contaminated spaces is a matter of life and death. Health officials stress that one must never use a broom or a vacuum cleaner in an area where rodent activity is suspected, as these tools launch dried viral particles directly into the air. Instead, the standard protocol is wet cleaning, saturating the area with a disinfectant, specifically a solution of 10% bleach, for at least 5 minutes before wiping it down with paper towels. This process neutralizes the virus's lipid envelope, rendering it inactive. Furthermore, effective prevention requires rodent proofing or exclusion. This involves sealing any entry points larger than 1/4 of an inch, which is the smallest space a mouse can squeeze through, using durable materials like steel wool or lath metal. For those in the maritime and logistics sectors, this means maintaining rigorous deck watch protocols and ensuring that cargo handling equipment is stored in a manner that does not provide nesting sites. These simple, yet often overlooked physical interventions remain the primary line of defense against a virus for which there is no widely available vaccine or specific antiviral treatment in the West. The surveillance aspect of this crisis is governed by what experts call the one heal approach, which recognizes that human health is inextricably linked to the health of animals and our shared environment. In European ports and surrounding urban centers, this manifests as a massive, coordinated data collection effort. Authorities are not just monitoring human hospital admissions, they are tracking the population density of field mice, bank voles, and rats, as well as the masting cycles of trees which provide the caloric surplus that leads to rodent population explosions. By analysing these environmental triggers, public health agencies can issue early warning alerts to clinics and hospitals before a spike in human cases occurs. However, there are significant limits to our current knowledge that demand a degree of professional humility. The incubation period for hantavirus is notoriously long and variable, typically ranging from 1 to 5 weeks, though cases have been recorded up to 8 weeks after exposure. This delay creates a diagnostic fog, where a patient may present with severe symptoms long after they have forgotten a brief encounter with a dusty storage unit or a cargo container. Additionally, while human-to-human transmission is currently considered an extreme rarity, the medical community remains vigilant for any genetic mutations in the virus that could alter its mode of spread. This uncertainty is why continuous genomic sequencing of environmental samples is a non-negotiable component of modern biosecurity. As we conclude this report, the ethical dimensions of the worst-case scenario must be considered. There is a delicate tension between the need for stringent biosecurity and the necessity of maintaining the global trade that sustains modern civilization. To stigmatize specific ports or regions based on the presence of a zoonotic virus can have devastating economic consequences for developing nations, potentially undermining the very infrastructure needed to fight the disease. The goal of international health reporting is not to incite panic or to promote the isolation of nations, but to foster a culture of transparency and shared responsibility. By acknowledging the limits of what we know and focusing on the rigorous application of scientifically proven prevention methods, we can mitigate the risk of hantavirus without disrupting the global exchange of goods. This is a call for calm, calculated action rather than alarmism. Public health is a collective endeavour, and our safety depends on the integrity of every link in the global supply chain, from the remote field to the bustling port and the home. The most effective weapon against an emerging viral threat is not fear, but the relentless application of data, sanitation, and professional vigilance. For ongoing updates on global health reporting and the science of disease prevention, consider subscribing to this channel.